Welcome to Snackable Health with Gibson Cully, and we're talking about Roe versus Wade being overturned today. Well, talk to us about the medical, not the geopolitical, societal, but the medical implications of this pile.
Mike, as a physician, I'm sure you would agree. And we've also seen statements come out from the American College of Gynecology and the American Medical Association that all of us in the medical community are really horrified about this decision because, in a way, it's really tied our hands from a medical perspective. And we know that sometimes termination of pregnancy is a medical decision or a medical intervention that has to occur to either save the mother's life or because the baby has no chance of surviving outside of the uterus, or for a host of other reasons as well. So taking that ability away by making a termination of pregnancy illegal in some states, I think it's really going to have a huge impact on women's health. I also think it's going to have an impact on maternal death rates, which is maternal mortality, and maternal complication rates, which is maternal morbidity, because we know what happens when women don't have access to legal abortions. The New England Journal of Medicine put on an editorial this morning that said they don't stop having abortions, they just stop having safe abortions. So the data is suggesting to us that we're actually going to see an increase in maternal morbidity and mortality, with modeling suggesting a 7% increase occurring in the first year and a 21% increase occurring in subsequent years, which I think we've really sort of created a huge problem for the healthcare system with that sort of, restriction.
And this is, of course, an issue that will then be determined state by state, correct?
Well, that's kind of an interesting point. So yes, it's going to be individualized from a state perspective. But when you're talking about women who may be seeking a termination, either for medical reasons or other personal reasons, then how does it affect crossing state lines? Would that be criminalized? And that's something that the federal government really has to weigh in on. And also, could they get a prescription for, the abortion pill, medication to terminate their pregnancy from another pharmacy in another state? Would that be considered criminalized? So there are a lot of issues I think that have come up, logistical issues, because there's going to be so much heterogeneity amongst the different states. But by the virtue of this no longer being a federal constitutionally mandated right, I think it's going to create a whole bunch of ripple effects that's going to affect everyone, no matter which state they live in.
Great. Well, thanks for helping sort all this out today, Pyle, and thanks to all of you for joining us here at Snackable Health.